We have been talking about good spinal health and how to prevent injuries and really how back-related problems occur, disc problems occur, talking about the curves in our spine and neutral spine and flexing our spine. So most injuries occur when we have a certain amount of capacity that our tissues, our ligaments, our muscles, our disc can handle. And when we exceed that capacity and we exceed the tolerance of those tissues, we end up tearing the tissues. So the most common way we see people is when we have these normal forward curve, this is the front, this is the back, and we see people that repetitively bend over at the waist. They hinge from their lower back versus properly hinging from their hips and maintaining a stiff or neutral spine. So when they sit prolonged, when they're in the gym working out, when they're at home doing laundry and bending over to pick things up, there's only so many bends in our spine. And what will happen, so I'll show you with a coat hanger, give you a simple analogy, is that over time, when we just constantly bend and hinge from our lower backs and not our hips, we develop weakness and we develop fatigue, and then over time, as you know, if we do this enough, that's going to tear, that's going to break, and that's the same thing that happens in our tissues. We exceed the tolerance of those tissues and it snaps and we tear tissue. We get inflammation, we get pain, we get muscle spasms, we get locked up. So that's a simple way of talking about flexing. We talk about in-range flexion, or in a big word would be flexion intolerance. Basically, when we bend over at the waist and we bow that backwards curve or that forward curve backwards, and we do that repetitively over time, we're going to hurt our back. So if you have any symptoms, lower back, disc-related problems, any numbness, tingling, anything down your leg, it could be a possible disc problem, ligament problem, joint problem. So we're here to help you. If you have any questions, give us a call.